Hi, my name is Kayla. I'm going to be your nurse for today. Can I just have your name and date of birth? Do you have any allergies? Okay, so I'm just going to check what's running. So I see that you have D5 a half normal saline running at 80 milliliters per hour. Your tubing looks good, not kinked. I'm going to check your IV site. I already washed my hands. Okay, I washed my hands. There's no kinks. In the tubing I see, the site looks clear, not swollen, not red, not tender. There's no leaking. Everything looks good. So I'm just going to grab my materials and I'll be right back to give you your Lasix today. Okay, so obviously I don't have a MAR. So what we would do is we would take the chart, the patient's chart. We would go to the MAR. We would open up the MAR. We look at the physician orders compared to the chart. I see that we're giving furosemide Lasix 20 milligrams again, which comes in a vial. It matches up to the MAR. We see that D5 a half normal saline is running. So we're going to close the MAR. We're going to return the chart. We're going to wash hands, come back to the MAR. We're going to go to the Pyxis. We're going to grab the Lasix out. And then when we grab the Lasix, we're going to grab our IV book and see if our Lasix is compatible to what is already running, which is our D5 a half normal saline. We open up the IV book. We look at dilution first. It says it may be given undiluted. We look at compatibility next. It says the solution in larger doses is normal saline lactated ringers or D5W. What we have hanging is D5 a half normal saline, which means that our medication or what we are administering, Lasix, is not compatible with our D5 a half normal saline. We don't have to worry about medication because there's no medication mixed up in our what's already hanging. So next we look at rate of administration. It says for IV injection, each 40 milligrams or a fraction, it should be given 1 to 2 minutes. We are going to give it over 2 minutes because this is within the safe range. So again, we're going to do our math. We have 2 milliliters over 2 minutes, which was the doctor's order. Half of that is 1 milliliter over 1 minute. And then half of that is 0.5 milliliters over 30 seconds. That is what we're going to give our Lasix. So we're going to close the MAR. We're going to close our Pyxis. We have our Lasix. Comes in the vial again. Everything is closed down. We're going to grab our 2 ml flushes. We have our 2 flushes. I have an alcohol prep pad for both. I have their Lasix syringe. It already has a label, so we don't get it confused with a normal saline. So now we are ready to go in our patient's room. Again, we're going to wash our hands. We're going to introduce ourselves again. We're going to ask the patient their name, date of birth. We're going to check their site again. We're going to scan their wristband. We're going to ask for allergies. We're going to pull up the MAR again. Again, we're going to scan the wristband. We're going to check the Lasix one more time. It matches. Again, remember our Lasix is incompatible with our D5 half normal saline. So before administering, we want to shut off the machine. Okay, so we're going to take out our normal saline. We're going to make sure we have no air bubbles. Okay, flick, make sure there's no air bubbles. Make sure there's no air bubbles. We're going to set it up by, we're going to have normal saline, then we're going to have our Lasix, and then we're going to have another normal saline bottle. So it's all set up for us. So we're going to draw up our Lasix. We're going to take the alcohol swab. Again, cleaning the vial. We're going to put 2 milliliters of air because that was the doctor's order. Inject it. Flip it. Get the 2 milliliters. Make sure there's no bubbles. Flick it. Okay. There's no air bubbles. Okay. Okay. We have our 2 flushes. Since it's incompatible, we need those. We already made sure that there's no air bubbles. So now we're gonna wash our hands again. We're gonna put on gloves. We're going to turn off the IV since it's incompatible. So the machine's shut off. So that means the D5.5 normal saline is stopped. Our site looks good. We're ready for the first flush. Okay. So we're going to do the lower port. We're going to take another alcohol swab. See if we can turn it. Okay. So we're going to clean the lower port with alcohol. Pinch. We're going to put 2 mLs in slowly. 2 mLs are in. Aspirate, check for blood. We see blood. So now slowly we're going to inject the 8 milliliters left. Okay, now we are ready for our Lasix. Oh, fix the patient. Okay, so again, we're going to clean off the lower port again. Remember, we're going to do the 0.5 in 30 seconds. That's the math we figured out before we started. The difference between this one is that we're going to hold the pinch the whole time. And while watching the clock, the second hand. Okay. We're going to put it in slowly, holding the pinch continuously. Slowly. Okay. We administered our Lasix. We're going to do our last normal saline. Again, new alcohol pad. For the last normal saline, we are going to it's going to be at the same time frame as the medication. So we're going to do 2 milliliters at 2 minutes at 0.5 over 30 seconds. Still watching our clock and with a continuous pinch. Okay. Putting it in slowly, continuous pinch at the 0.5 over 30 seconds. Okay. We're going to take our gloves off. We're going to wash our hands. Check the site. The site looks good again. We watched the site the whole time. We are going to put our machine back on at 80 milliliters per hour. We're going to document, ask the patient if they need anything, clean up our area, hand them the call light, push the bed down, and we're finished.